Today, we will be talking about person-centered care and what it means in the community pharmacy setting. Once commonly referred to as patient-centered care, the term has evolved to better understand that patients are people before their condition, and their needs, values, and preferences are important. So what is person-centered care? Well, we asked you.
Person-centered care, to me as a pharmacist in the community pharmacy setting, is providing healthcare advice and solutions to individuals of different demographics and ages and tailoring that advice accordingly.
To me, it's seeing the patient as an individual with their own problems and feelings that all need to be addressed when caring and dispensing.
We agree. The pharmacy community really does care about each individual and aims to treat them with respect, dignity, and individuality. We would define person-centered care as considering all aspects of a person, including their values, desires, lifestyle, and social circumstances. Seeing the person as an individual and working together to get the best possible health outcome. The 8 dimensions of person-centered care. What does this involve? Originally outlined in 1993, the PICA framework was the first healthcare approach which encapsulated high-quality healthcare as being patient-centered and has been continuously revised for the optimal outcome. Now, let's get into it. 1. Respect for the patient's values, preferences, and expressed needs. This principle aims to involve the person in the decision-making process and consider their values and desires. More so, ensuring that everyone is treated with dignity and respect to their cultural values and autonomy. 2. The coordination and integration of care. The second principle involves the healthcare system working together, coordinating, and advising each other for the best possible health outcomes. 3. Information and education. This important principle aims to work with the patient to ensure that they are well informed and not just told about their condition or prognosis. This can involve counselling, information cards, self-care, and health promotion. 4. Physical comfort. This principle aims to encourage health professionals to ensure that the patient is comfortable and well informed with the medical changes and is aware of any possible side effects. 5. Emotional support and alleviation of fear and anxiety. It is important to comfort people and ensure that they aren't fearful. 6. Involvement of family and friends. This principle addresses the role of family and friends in the patient experience. 7. Continuity and transition. Ensuring a patient is confident in continuing the treatment out of the healthcare facility and that they know where to seek help. And lastly, 8. Access to care. This domain refers to any aspect of accessing care. Why do we do it and why is it important? People come to pharmacists for advice and recommendations because we are health professionals and people feel comfortable confiding their concerns and illnesses with us. Person-centered care is important in the pharmacy setting as it directly impacts the desired outcomes in the healthcare setting. Having quality person-centered care can lead to overall improved experience with the healthcare system, greater satisfaction with quality of care, and better health outcomes. This is because quality person-centered care improves compliance, builds trust, and maintains pharmacist-patient rapport. Now the question is, how do we maintain all of this now that everything seems to be online?
Multiple new pharmaceutical systems and technologies have been developed to promote greater efficiency and streamline the customer experience. As modernization continues to change the services offered for patient care, it's important as medical professionals that we reflect on these new systems and how they change our approach to patient-centered care. Technology has facilitated the improvement and optimization of many different aspects of person-centered care. Automation allows for clearer communication between treating health professionals, ensuring that each individual is being provided with the best healthcare solutions possible. The development of electronic prescriptions is a great example of how this automation is being implemented into current pharmacy services. Providing greater access and availability of treatment to a broader scope of individuals not only decreases the rate of morbidity within a community, but it also allows for greater treatment compliance. Online click and collect and delivery services are the perfect model of how technology has improved person-centered care, as it allows patients to purchase medications, browse for treatment alternatives, and pick up their order at a time best suiting their needs. However, as technology improves the convenience of a patient's pharmacy experience, the barriers to person-centered care found in these new services should be recognized and reflected upon. Through the identification of these barriers, certain elements of person-centered care are less likely to be overlooked. For example, e-script services, whilst convenient, reduce the incentive for patient-pharmacist interactions. This may incidentally deprive the client of the opportunity to discuss their individual needs or concerns for their treatment plan, unintentionally limiting the patient's autonomy. Additionally, by not taking the opportunity to build a trusting relationship with the patient, the pharmacist may miss the chance to discuss more personal matters with the patient, such as encouraging the involvement of their family and friends in their holistic care. Furthermore, the reduction to face-to-face interaction has the potential to significantly reduce the opportunity for the pharmacist to provide the patient with adequate counseling about their individual circumstances and the subsequent treatment. This may cause further problems, as confusion over a patient's therapy can easily lead to a lack of confidence in their continued treatment once removed from a healthcare facility. Although services such as online click and collect or delivery may provide greater autonomy to a client's pharmacy experience, the quality of person-centered care can be significantly affected. By failing to build patient-pharmacy rapport, services normally offered, such as physical or emotional support, may be neglected. By reflecting on how these new technologies present potential barriers to the pharmacist-customer relationship, we can instead find ways to use these tools to optimize person-centered care, ensuring that each person receives the same quality standard of individualized care.
Let's take a look at Emily. Emily had a telehealth call with her doctor and received an e-script. On her way home from work, she stops over at the first pharmacy that she sees. The pharmacist sees Emily walk in and greets her with a polite, "Hello, how can I help you?" as all the support staff are busy with their other customers. Emily hesitantly says that her doctor has sent her script to her phone, looking a little confused as she is used to traditional scripts. The pharmacist says no problem, just click the link and scans in the code, then checks to see if Emily has had the medication before and if the generic brand is suitable. "I think so, and yes," says Emily. The pharmacist dispenses it almost immediately. "That was quick," says Emily, feeling a little confused about the process. The pharmacist feels glad that they have provided Emily with efficient and quick service, especially during peak hour. While this is a usual interaction with customers and has definitely provided accessible and an integration of care, how could it have gone better? Let's take another look. When Emily shows the e-script, notice how she seemed anxious about it. Simple questions such as, "Have you used an e-script before?" could make all the difference. Offering an explanation on how an e-script works or a printed token could be all that is needed to alleviate any stress or concerns that Emily was feeling. With doing this, we are respecting and considering her preferences, providing information and alleviating fear or anxiety. From this, we've placed the stepping stones to building a relationship with Emily, where we can assist and with continuity of care and other aspects of person-centered care. Emily feels like she is in the loop and that her preferences were considered. Most importantly, feels involved in the decision-making process.
Thank you for listening today. Let's continue to be the family that we are.